We know that vaccines are one of the most powerful interventions we have. There's a saying that says, vaccines do not save lives, immunization saves lives. So that's, in a way, the mission of IVAC.
The International Vaccine Access Center at Johns Hopkins is a really interesting center that brings together a really diverse group of professionals: epidemiologists, economists, clinical trialists, policy people, advocacy, communication people, who work on problems in the vaccine and immunization space to pull together that diverse range of expertise to drive at innovative solutions. IVAC is centered, it lives, it's housed within one of the oldest schools of public health in the world, one of the largest departments of global health in the world, and it is fundamentally committed to using evidence and data to drive its decisions.
IVAC helps generate, synthesize information, translate that evidence to policymakers so that they can make informed decisions about vaccine introduction and strategies for the use of vaccines, and then to bring those vaccines into communities to achieve the access that's needed and to evaluate how that process is working, to measure the access and to ensure equitable and complete coverage in communities.
In the past, there's never been a center like the IVAC, the International Vaccine Access Center, where the goal and the mission and the vision is to make sure there's no child that's left behind.
We're celebrating our 10th anniversary, building upon the work that we've done over the past decade. But there are many challenges ahead. We have challenges with our current vaccines, trying to get increased coverage, for example, with measles and rubella vaccine. But we also have new vaccines with new challenges in expanding access to vaccines such as the rotavirus vaccine, challenges to increasing access and equity for the human papillomavirus vaccine.
Humanitarian crises are increasing, displaced populations are on the move. There's a tremendous increase in urbanization, and especially the urban poor.
We measure the economic value of vaccines through our work in the economics and finances of vaccines.
In Bangladesh, for example, one episode of rotavirus can end up in wiping out that family's income for the whole month. So we have a great obligation to make sure we stop this cycle.
To bring that evidence into policy through advocacy, through developing communication tools, through developing websites that disseminate accurate information about vaccines, such as ViewHub and Voice.
So those are very big challenges, and there are no simple answers to that. But I think IVAC certainly is in a position. They can make a big dent in this issue, and we will fulfill our mission, which is to make sure that every child has access to vaccine, and we will not rest until that happens.